health care is very important, and we need to do what we can to continue to support rural health care, continue those programs that were put in place a decade ago to assure that rural hospitals don't close. By keeping a hospital open, it retains jobs in those communities, and truly hospitals are kind of the heart of a community. If you don't have hospitals, you don't have care, you don't have jobs, and your community disperses.
Without the small rural hospitals and the critical access hospitals, we are not going to be able to bring people back home where they want to have their care. They don't want to necessarily be in the city, be in the big city and away from their families and so forth. They want to be able to experience that quality care right in their own neighborhood.
All right.
You guys need some help?
Yes, I do. I need to see a doctor.
We have to be able to figure out how do we bring those services to them in their home and in their home community and build those home communities. These grants, some of the planning grants, some of the pilot programs have given us an opportunity to see what does work, how can we provide those services out there, and then how can we duplicate those in other areas and so forth.
All of Nebraska hospitals are set up with trauma backup services via telemedicine. And so that traumatic patient comes into the emergency room, and it's a flip of a switch or a couple of buttons, and you have a trauma physician, trauma surgeon who can advise and just be a backup.
Finding a workforce in a rural community is extremely difficult. That's where the HRSA funds, flex funds and SHIP grants in particular come into place. We're able to, by collaborating together with other rural hospitals and with our network hospital, we're able to educate our staff in such a way that we continue to provide excellent, again, high quality, safe care and keep those employees that we had so much trouble recruiting, keeping them engaged and therefore retain them. We need to prove that we can provide as good a care in rural communities as can be achieved at a tertiary care medical center. We don't just say, hey, we're as good or we're better, but we want to prove it, show you the numbers, and so you can make an informed decision.
HRSA grants are important and are critical to our survival because of the training that we can provide our staff. We are able to send them to training that helps them improve our quality of care. It helps them provide better leadership within the facility. It keeps them engaged, it keeps them involved, and it keeps them in the community. We actually saw a tremendous boost in our HCAP scores when we did personalized patient-centered care, because the patient feels like we're engaged with them. They feel like they're engaged with us. You're going to get better care, and it's all because of the training, the advanced training that we were able to give them.
Even though it may seem that the funds that we receive from the federal government are small in amount, we are able to parlay those funds into a significant improvement in the quality of care in hospitals in rural Nebraska.